Hi everybody, welcome back to Remedy Pharm Health Minute. This is Amina, your pharmacist in charge here at the Remedy Pharm. October is Breast Cancer Awareness Month, so I wanted to take a few minutes to talk a little bit about stats of breast cancer, some risk factors, what you can do at home to minimize some of the risk factors that are actually in your power, and how your clinical pharmacist really plays a role here. So, as you know, breast cancer is one of the most common cancers among American women, just aside from skin cancer now. I think it's that 1 in 7 women may get breast cancer. So mammograms are still the best way to find breast cancer early and detect it before any of the symptoms really appear. So make sure that if you are at average risk, if you're between, I think, over 50 years old, you're checking with your doctor to make sure you are getting your mammogram scheduled every 2 years. Breast cancer affects women mostly from 50 to 74 years old, and your risk increases as your age increases. But that's not to say that younger women don't get breast cancer, because new breast cancer cases, at 11% of them are under 45 years old. So women young and old can get breast cancer. Guess what? Men can get breast cancer too. It is a lot less, but it's still there. Men, usually you see it at 60 to 70 years old, and less than 1% of breast cancer cases are in men too. So that's like a little less than 1 in every 100 cases. So it's things to keep in mind. I know COVID is making it really hard for people to get in to see their doctors, but definitely make sure you're scheduling your mammograms for every 2 years or whatever your doctor recommends for you. Remember that at home you can do a self-check breast exam as well. So I definitely encourage you to make sure you're continuing with that too. Some of the symptoms of breast cancer, as we talked about a little bit, some of the symptoms are, changes in the breast size, the shape. You might get nodules in there, or you feel lumps. The traditional, you feel lumps. It can be painful, so know that that's not very typical. That you shouldn't have pain in your breast. You can have discharge that's not milk. It can be blood from your nipple as well, among many other things, but these are some of the ones I wanted to point out. You might even have pain in your armpit because the lymph node kind of travels between the breast and the armpit. So these are some of the things that you may want to contact your physician for as well. Some risk factors we did go over: being older and older, being a woman, number one. Being older is another one as well. And another thing is if you have genetic genes of the BRCA1 or the BRCA2 is another risk factor for breast cancer. Some risk factors that you can change at home: being physically active. It's shown that if you are not physically active, that may increase your risk of breast cancer as well. So definitely increase that physical activity, 30 minutes a day, 3 to 4 times a week at a minimum. And it doesn't have to be really excruciating exercise. It could be taking a walk in the park, a good walk, and in times like these, or even every day, to help with the everyday stressors, it's really, really helpful to kind of clear your mind, go outside for a nice brisk walk. Obesity, being overweight, is also a risk factor that we can try and control at home as well. I mean, through diet and nutrition, we're noticing we're getting more and more educated out here, right? So you're seeing that our nutrition is pretty deficient, a lot of vitamins, and our bodies are not absorbing appropriately as well. We're searching for those sugary foods and those comfort foods more and more. So let's just try to institute small, meaningful changes in our everyday would be really helpful here. So that's another thing that we can try and control at home. Other things are like drinking alcohol, smoking. It's shown that if women who are drinking more alcohol, if you smoke, that is an increased risk for breast cancer, among other cancers as well, of course. Reproductive history is something that puts you at higher risk as well. So if you're having late pregnancy, they say anything over the age of 30, that's something. If you haven't been breastfeeding, that's another thing. I know some of these things we really can't control, right? But it's worth noting, I feel. Research suggests, like I said, that smoking can increase it. Environmental toxins can increase our risk as well. As a pharmacist, I always feel it's necessary to bring to light our role in your recovery and your path to wellness and health, right? So your clinical pharmacist is a really great resource here. Clinical pharmacists, they provide so much education, so much support, and they are such a vital role in the healthcare team overall. Your clinical pharmacist is the one who's going to check to make sure there's no drug interactions between what you're taking and anything else that you may be taking, any other prescription medications, any other nutritional supplements, herbals, all of that kind of stuff. So definitely make sure that you have a clinical pharmacists on your healthcare team to make sure and guide over there and in that route. They make sure that there's, like, in addition to drug interactions and adverse effects, meaning adverse reactions are, you know, if you have any lightheadedness, if you have any reactions to the medications that you're on, you know, stomach issues, all kinds of things. So they try to help minimize and reduce that with helping your treatment as well. They always make sure they check with your doctor to help minimize your adverse reactions as well. Some of the other things are making sure that your body is working the way it needs to, right? So elimination, this is getting a little bit more clinical, but making sure that your liver is working the way it needs to so that the medicine isn't getting all toxic in your system. This is like, these are just so important for you as a patient. So definitely reach out to your pharmacist anytime you have any questions. We're here at the Remedy Pharm. We're to help you guys out and guide you as well. So just come to us with any questions that you may have, any concerns, and we can definitely guide you here. So that's it from me for Remedy Pharm Health Minute today. I hope you guys got a lot of information, and I hope you are all doing well. Take care, and definitely stop by with any questions. And you can even stop by for your breast cancer awareness pin. So thanks for spending a few minutes with me today, guys, and we'll see you next time. Definitely make sure you like, comment, share, and subscribe to our channel for more.